Wow, it's been a challenging year for all of us, both professionally and personally. But I will say I'm really proud to be a physical therapist, the resilience we've shown as a profession, and our ongoing ability to provide essential services to the people in our communities. We've worked hard on advocacy, but we can't stop because unfortunately on August 3rd, the Centers for Medicare and Medicaid put out their proposed rule, and that proposed rule means that on January 1st of 2021, there will be a decrease of approximately 9% in the reimbursement that we receive for Part B, those rehab, those outpatient services to Medicare beneficiaries. What will that do? That will cause many healthcare businesses to simply have to shut their doors because they will not be able to remain open with a 9% decrease in reimbursement. For those that do remain open, the salaries will significantly decrease for our clinicians. Access to care will become a problem, and your Medicare beneficiaries will not get to deal with things such as fall prevention programs, the opportunity to reduce their risk of opioids, as well as other much more expensive medical interventions. So we must act now. Now, you may be asking, why is this happening, especially given the pandemic? The reason it is happening is because Medicare must remain budget neutral. And last year, they determined that they would increase codes for E&M, or evaluation and management codes, which are typically provided by primary care physicians. Of course, we support that primary care physicians should be paid more for these codes. However, we don't want this to come at an expense to the rehab services for PT as well as OT speech and other services. So we need to take action now. We can do that in two different ways. Now, what I would urge you all to do is, whether you are a member or not, a PT, a student, assistant, a patient, go to the APTA website. They are working extremely hard to try and help prevent this cut in reimbursement. You can go to the apta.org advocacy issue, and there's two parts where you can go to. One is for members and one is for non-members. At this stage, we don't care if you're a member or non-member. We just need you to act. If you go to the member section, there are already pre-written letters that go to your members of Congress. The reason we need to reach out to our members of Congress is they are able to pass legislation, and currently they're looking at both short-term and long-term legislation that could create more money or a bigger budget to CMS so that they could restore the reimbursement that we currently receive. So you're going to reach out to your members of Congress. The next lot of people you're going to reach out to is actually CMS. And here there is a Regulatory Action Center where you will find pre-written letters for you, whether you're a PT, PTA, student, or a patient. You can use those pre-written letters and then simply submit these to CMS, to the regulations.gov. This will help CMS understand the impact that decreasing reimbursement will have on their ability to provide care to Medicare patients. So I ask you all now, for the sake of our profession, for the sake of our patients, please act. Contact your members of Congress and contact CMS. If these cuts happen, other payers will follow suit. They will follow what CMS does. So a decrease in reimbursement from CMS will then create a cascade, and other payers will then decrease their reimbursement, having more of a detrimental impact on our communities. So please act now. Now is your chance to be heard and make a difference. Thank you, and stay strong.